Today we're taking a deeper look at the HIPAA Privacy Rule and what it actually means when it comes to accessing a patient's medical record. This is one of the most misunderstood areas of HIPAA compliance, and it's also one of the most common sources of violations. Before we examine the consequences of improper access, it's important to understand the foundation of the privacy rule itself. The HIPAA Privacy Rule establishes national standards for how protected health information, or PHI, may be used and disclosed. Its primary goal is simple: ensure that individuals' health information is properly protected while still allowing the flow of information necessary to provide high-quality healthcare. The rule covers all forms of PHI: electronic, paper, and verbal. It applies to healthcare providers, health plans, and healthcare clearinghouses, as well as business associates who handle health information on behalf of those entities. One of the most important sections of the privacy rule relates to the patient access rights. Patients have the right to access, inspect, and obtain copies of their medical records within their designated record set. This includes medical histories, diagnoses, lab results, imaging, billing records, and any data used to make decisions about their care. Organizations must verify the identity of the requester and provide the information in the requested form or format. PHI must be supplied within 30 days unless an approved extension is documented. However, it's equally important to understand that not all access is permitted. The privacy rule follows what's known as the minimum necessary standard. This means workforce members should only access the information they need to perform their job duties. For example, a billing specialist should not access full clinical notes unless those notes are required to complete a billing function. A nurse in one department should not open charts for patients being treated in an entirely different unit unless they're involved in that patient's care. And simply being curious or looking up someone you know personally never qualifies as a valid reason. The privacy rule also outlines when access may be denied. Organizations can deny access to psychotherapy notes, information compiled for legal proceedings, and situations where a licensed healthcare professional believes releasing the information may endanger the patient or another person. But even when access is denied, the patient often has the right to request a review of that decision. Now let's discuss what happens when someone accesses information that they shouldn't. Unauthorized access, even if it's unintentional, creates a potential HIPAA violation. Examples include opening the wrong patient chart, viewing information for patients you're not treating, or accessing records out of personal interest. These actions breach the minimum necessary standard and must be reported internally according to the organization's compliance protocol. When unauthorized access occurs, organizations evaluate several factors: the nature of the information viewed, whether the access was accidental or intentional, how long the information was accessible, whether the information was used or disclosed further. In many cases, accidental access leads to corrective action, which may include retraining on the privacy rule and the organization's internal policies. This helps reinforce appropriate access and ensures that workforce members understand the systems and safeguards in place. Intentional access is treated more seriously. Accessing records without a legitimate business or clinical need violates both HIPAA and organizational policy. Depending on the severity, consequences can include disciplinary action, revocation of access privileges, or termination of employment. The privacy rule makes it clear that individuals do not have free access to all patient information simply because they work in healthcare. Every access needs a purpose. Only view the information necessary to complete your task. And if you aren't sure whether you're permitted to access something, ask your compliance department or supervisor before moving forward. Understanding what the privacy rule allows and what it prohibits is foundational to maintaining patient trust, protecting sensitive information, and ensuring your organization stays compliant. If you'd like to learn more about staying compliant in the healthcare space, reach out to K2GRC.